Welcome to this edition of Utah Business Matters, your weekly television window to small business here in the state of Utah. And we begin in Midvale in front of the Hope Clinic, founded by Dr. Mansoor Emam, enthusiastically dedicated to help those who are less insured.
I was living in Iran, in a remote area of Iran, basically, that was very underdeveloped with lack of access to healthcare at the time. The seed was planted during childhood. My dad believed that the most effective way of achieving joy in life was by giving, by sharing, by serving. That's when I decided, both myself and my brother, that we wanted to be physicians and go back and work and serve both.
I met Mansoor for the first time when he was a medical student at the University of Utah. He started volunteering in the emergency department at Cottonwood Hospital.
To be around Mansoor is to just feel his amazing spirit and his devotion to selflessly helping people.
As I worked as an emergency department physician here in Salt Lake City, I noticed there was a large portion of part of the patient population that we served that didn't have any access to care, and they would end up therefore in the emergency room for their basic care.
When we recognize that there are many people in our community who just don't have resources and don't have insurance and have a very difficult time finding their way to get medical help, they just go without. Often they go without too long, and therefore when they come in they have very severe needs.
They go through the most expensive entryway into our medical system, which is the emergency department. They end up costing the society and the global picture of the healthcare much more than if they were taken care of at the beginning of the process. Mr. Holmes, my longtime dear friend and patient, passed away, and his wife asked me that if we could do something in his honor and his memory. We decided that we opened this clinic here where his office was, and we built this magnificent, welcoming, bright clinic that stands in where his office was in his honors.
The Wednesday before Thanksgiving we saw 77 patients, and yesterday we saw 71. And in our little 1,600 square foot clinic, that's a lot of people to pack in. This is such a team effort. We are 100% volunteer. We have babies to the elderly. I think the oldest person we had was 95. They all share one thing in common. They all are in need of help. On a consistent basis, we have our physicians that come, and they have background in family practice, internal medicine, and emergency medicine.
You know, we have a whole corps of nurses, laboratory people.
And then once a week we have a wonderful OB/GYN doctor. We don't do the OB part, just the GYN. And then we have an orthopedic surgeon that actually has retired and comes and sees our patients on a regular basis, at least once a month.
Hope is 2 days a week. We are going to expand it. I have been negotiating with 3 of my psychiatrist friends. We'll be starting a psychiatry and counseling day, as well as will be down the road, the next step after a year would be establishing pediatric day.
And one other really gratifying thing is the number of our patients who come in and have received care say, I want to help, I want to give back.
The difference between this and people who go work a 12 or 14-hour shift in the emergency room like I do for a living, or ICU, I enjoy both immensely, but the only difference is when I leave here, I leave with more energy than I started at the beginning of the day.
Intermountain Healthcare, we could not exist without them. They donate all of our lab work, which is enormous. Intermountain Healthcare employed physicians see our patients for $20, which is huge.
It's nice to feel like you can be part of the solution, at least, or to provide some care for people who really don't have other avenues.
Is this enough? Of course not. We have 300,000 Utahns that are uninsured, and the majority live in the greater Salt Lake area. This is not the solution to resolving the overall crisis for the underserved and uninsured. but it's a step in the right direction. We have seen over 120,000 patients between the two clinics. To those 120,000 patients, it makes a difference.
A lot of our people are working, there are service industries, and they don't have the opportunity to get health insurance because if they chose health insurance, they wouldn't have groceries.
So if you were a diabetic, your choice was between buying your insulin or food. Lack of care. The system's obviously broke. As a nation, we have to come together. If we can land a man on the moon, we can solve this problem if we want to.
I've been a nurse for over 30-some years, and I have seen massive amount of changes in the technology and the approaches of how we treat people, but the one thing that's constant is listening and touching and just making time for them.
As you notice, everybody that's here smiles and go out of their way to help patients and each other. By self-selecting to be here, that's the key. They're here to serve. And what the clinic does is plants the seed of love and serving.
He is our engine. He gets us going. He's the start of it. There's a lot of cabooses hanging on. He's the person that is, gets the excitement, the motivation, the resources, and helps us. He's our mentor.
She's here 3 days a week, often 12 to 14 hours, and she is the person that runs the clinic.
Most nonprofits really struggle just to break even. That's the goal, is to break even. But there still is a certain need, and we just have to monitor what that is and then hopefully be out there finding people whose hearts are soft and who have the opportunity to give.
Often people will say, you know, what if Dr. Emam leaves or St. Jane leaves? As you know, these clinics run on the philosophy, not individuals.
And the biggest gift, really, even in this volunteer situation, is given to us. It's the privilege to be able to take care of other people, because people put their trust in you.
As I think it was Churchill says, the world's cemeteries are full of indispensable people. These clinics run on the philosophy of serving, to give and to give unconditionally.